That was Ben Deneen, Gold Coast ultra trail runner and very talented musician with the Hillbilly Jam. I'm Brad Beer, sports physiotherapist and exercise scientist by trade and training and founder of Pogo Physio. This is part 4 of the Physical Performance Show's summer series. A punchy 4-episode series across January designed to help you kickstart your 2022 pursuit of your physical best performance with some key learnings. It's summer down under. Obviously in the Northern Hemisphere it's not, but we are still bringing you the heat with some great learnings to set up your calendar year. Today's episode is lovingly brought to you by Polar, world leaders in GPS watches and heart rate technologies. Now on today's summer series episode, we take a look at navigating common running injuries. There's some timely reminders here from some prior guests of the Physical Performance Show with some gold nuggets around best ways to deal and manage tendon, bone, joint and muscle related concerns. And kicking us off, we have Ebony Rio, National Health and Medical Research Council Senior Research Fellow, sports physiotherapist, who shared back on episode 222 a bounty of learnings around how to best navigate tendinopathy or tendon-related pain. Ebony is one of my favourite researchers and teachers in the field of sports medicine, and here's Ebony sharing some wonderful and simple practical tips on how to know how to navigate the pain that your tendon is giving you with regards to progressing your training. Here is Ebony.
So part of our education and part of our meeting people at their story is that we need to teach people that we actually don't listen to your tendon at the time, because your tendon can be a little bit naughty and you can get sucked in and feel really good and completely overdo it. So we want to base your load on what we know you've tolerated. So we're going to listen to your tendon, but we're only going to listen to it 24 hours after a load, and that's when it's going to tell us if it's happy with the load you've put on it or if we've overdone it. And a tendon that has low and stable pain after load is a happy tendon. Zero pain's ideal, but often our athletes will have some symptoms. As long as it's low and stable, that's super safe.
And Ebony, that's brilliant and rich. Don't look at the tendon at the time. As you say, the tendon can be naughty, so check in 24 hours later. And we're looking for, or the athlete's looking for low and stable pain. I think low pains, it's commonsensical, but what do you mean by stable pain?
What we're looking to do in our program is we're trying to take the person in front of us from their current capacity and their current load up to their desired capacity. And Jill and Sean wrote a great editorial a couple of years ago in BJSM, but Jill's been drawing this for, I'm going to say 30 or 40 years, and it's probably longer than that. But they published this editorial and it really explained that progressive step. And I draw it for my patients now. Right, this is your current capacity. This is all the things we've assessed today. And your desired capacity is your goals. What do you want to do? How far do you want to run? How quick do you want to run? Do you want to run hills? The absolute level of detail that your athlete is after, that's what we put up the top. And then what we have to do is go up in small steps, because tendons hate change. So you've got to sneak up on them a little bit. And the way you do that is to make small changes where they adapt. So you add some load and then the next day you listen. You add some load and then the next day you listen. So what I'm looking for in terms of stable pain is that as my load is increasing, my pain is either coming down to zero, or it's coming down to a very low number, which I'll negotiate with my athlete about what they're happy with, because everyone's different. So it's not for me to say. And then what we do is we look at that response each day, and if it's like, 1, 1, 1, 1, 1, 1, that's a happy tendon. If it's, 1, 2, 5, hang on, what have we added in here that the tendon's just letting you know? So, yeah, it's about, particularly in season, we often don't have zero pain, but again, just really, really reassuring people about that.
Reassuring them that it's okay to have this low and, as you say, stable level of pain 24 hours after we've tried to help them or they've tried to help themselves. Take those, as you say, small steps, because tendons don't like big changes. And you also mentioned there, Ebony, that as per your colleague Jill Cook shares, that it's about getting them back to where they want to get to. And I remember hearing Jill alongside yourself, encourage practitioners in that room that keep it simple. It's just a matter of figuring out where they are and where they want to get to and getting it done.
You bet. And that, for me, also should reinforce for people that there are no recipes. Like, by all means, we need to be evidence-based, and the best evidence is for load.
So if you're struggling with a frustrating, pesky tendon injury, Achilles, patella tendon, proximal hamstring tendon, or gluteal tendon, do jump over to episode 222 with Ebony Rio and up your learnings, and therefore prepare for a better outcome and less protracted and troublesome tendon rehab journey. Next up, let's take a look at one of the most frustrating yet common endurance-related injury, and that is that of a calf muscle strain. Back on episode 276, I had the pleasure of sitting with La Trobe Sport and Exercise Medicine Research Centre researchers and physiotherapists, Dr. Tanya Bazari and Dr. Brady Green, with a focused episode around calf strain rehabilitation. One of the common pitfalls runners and athletes make with returning from calf muscle strain injuries is their return to run program. Now, Brady and Tanya shared some wonderful practical tips on how to best navigate your return to run program off the back of a calf muscle strain injury. Here's what they had to say. As a practitioner, I find challenging, perplexing, and interesting the fact that it seems to be an art and science return to run programs, maybe more art in many ways than science. So any tips you'd share around returning someone to running with a calf strain injury?
Yeah, I think starting really simply, there's no escaping the value of our meat and potato things that we do as physiotherapists, where we're monitoring very closely how long it takes to return to pain-free walking, the length of palpation tenderness, and how quickly that resolves, the restoration of single-leg calf raise capacity and how long that takes, as well as the restoration of range of motion with like a dorsiflexion lunge measure, as well as a straight knee stretch. So early on, we're really getting an impression based on how these basic clinical measures are restoring versus not restoring, of how we're going and what we're estimating about when an appropriate time to return to running may be. And you're also getting good information from your patient or your athlete based on their ability to perform the exercises that you give them. So the ones that, quite soon, they're tolerating single leg calf raises through range. They're executing from a technical perspective perfectly. They're able to carry out loaded strengthening in bent knee and also straight knee position, and begin to develop some good strength endurance, whether it's a Smith machine or a seated calf raise machine. So suddenly you're getting confidence that they're having the endurance component as well as the absolute strength component. And during this time, which is part of the art, you're obviously reintroducing, the muscle tendon unit to stretch shortening cycle loads, and really elementary activities that require the stretch and the shortening component, like bilateral skipping, run drills, A skips, pogo skips, starting with 2 feet and then single leg. And the progressions I typically work with there are bilateral first, always, and then unilateral afterwards. But you should expect that if you've tracked the meat and potatoes clinical markers well and thoroughly, you've got confidence that they have load tolerance from their single leg calf raises and loaded strengthening. And in the background, they've built up some capacity with some low level skipping and plyometric activities that it'll be appropriate to return to running, which might be a few days later than you would return to running for, say, a hamstring strain. And that's okay, because what we find is that it doesn't necessarily slow up the rehabilitation process if you save your run to a little bit later, and it offsets that risk of recurrence early in your rehabilitation process. A clinical test, really simply, if a patient or athlete's able to do submaximal vertical hopping for 20 repetitions or 30 seconds on the spot, and they have no focal calf symptoms or no development of the awareness, creeping, heart attack type tightness, they're generally ready to recommence running.
That's a brilliant tip about not rushing to get that first run started with the perception that you're losing days. Those extra couple of days you just share there, Brady, can see an overall better return.
Yeah, absolutely.
The other thing to consider is that because calves do often come on with just that gradual onset, you can't necessarily use pain as a guide with exercise or return to running as a guide to, how they're going to go with it. Whereas with a lot of other, so for example, hamstring muscle injuries, you can get them to go for a run, and if they have that, they do often get that perception of tightness or pain, and you can pull them up there and stop the activity. Whereas calves, you might not actually get that until later, a few hours afterwards, or the next day, or because it doesn't necessarily, for those reasons Brady explained previously, it might not be a good indicator. So that kind of pain is not a good indicator for whether they're going to cope with the running or not. And the other thing that's different with return to running, sorry, Brad, is that, with a hamstring, you can get someone to just go off for a little jog as a start, because you don't use your biceps fem very much when you're just jogging. You can't do that with a calf, because we know that, as we keep saying, this, particularly the soleus, is working all the time. And so if you go and try and, get them to just get some endurance in their calf, some air in their lungs and get the heart pumping, it can really backfire on you. So you have to be a bit more particular, as Brady was pointing out, and make sure you feel like they're ready to run. And in some cases, it's better that they're running a bit faster initially, doing those drills, using the stretch shortening cycle, than just plodding a couple of laps around the oval.
And is that to try and offset some of that cumulative fatigue that poses a risk for soleus?
It was funny when we surveyed in our qualitative study the practices and perspective of experts from around the world. It was a really consistent theme that a nice recipe for a recurrence is to tell your athlete or patient for their first run to go and jog 5 laps or to jog for 10 minutes, and they'll get that constant work of the muscle that results in a fatigue-related recurrence, because they just don't have the capacity to withstand that type of loading just yet. Working through that data, it seemed to be more beneficial for a first run prescription to be more in the vicinity of 60 or 80 or 100 metre run-throughs with rest between, versus a run that you might prescribe for a run-of-the-mill hamstring strain if you want to be avoiding a recurrence.
And those run-throughs are accelerating or steady state, typically, Brady, at a faster pace than you would at a steady trot. Some degree of acceleration, I guess. Just going from a steady start.
It's within comfortable limits as well.
Yeah.
And this is where, you need to know the athlete or the patient that you're dealing with and how their function is at that point in time, and, base your judgment around those factors, how quickly you're going to tell them to run. But you certainly don't need to spook them and make them sprint and accelerate suddenly, which has happened in the past, but you certainly don't need to make them plod and just really jog and have really long ground contact times where, they're just working through their calf the whole time. It's kind of like a comfortable, happy medium.
So if you or someone you know in the endurance sporting world is struggling with a current calf muscle strain injury, or perhaps a series of recurring calf strains, do jump back episode 276 with your pen and paper for a bucket load of practical tips and excellent information from Tanya Pizzari and Brady Green. Support for today's show also comes from AMP Human and Momentous. Building the future of human performance. AMP Human, creators of PR Lotion, and Momentous, the cleanest, safest sports nutrition company, are merging together to build the future of human performance. PR Lotion is designed to maximize your training and recovery by unlocking bicarb, a natural electrolyte that improves muscle function and helps you combat fatigue during hard workouts. PR Lotion is used by some of the planet's best endurance athletes, including Ineos Grenadier and Ironman triathlon champion Cameron Worth. Train, compete, repeat with AMP Human PR Lotion. Now, as a special offer for the Physical Performance Show listenership, the team at AMP Human are offering 25% off when you buy from AMP Human's brand store at Bike Exchange. Use the code TPPS25 at checkout. That's TPPS25 at checkout. Get your hands on AMP Human's PR Lotion. And today's episode is also brought to you by Precision Fuel and Hydration, who have a range of tools and products to help you personalize your fueling and hydration strategy so that you can perform at your best. Long-term listeners of the show know Precision Hydration, but they've had a name change to reflect the fact that they've been helping athletes nail both aspects of their training and racing for a long time now. Everyone sweats differently, and the amount of fuel we require varies depending on factors like the duration and intensity of our activity. So a one-size-fits-all approach to fueling and hydration just doesn't cut it. Head to precisionfuelandhydration.com, take their free online sweat test, and use the quick carb calculator to understand your fluid, electrolyte, and carb needs during training and racing. Now, as a listener of the show, you can get 15% off your first order of fueling and hydration products by using the code TPPS22, that's TPPS22 in capitals, at the checkout at precisionfuelandhydration.com. For now, let's jump back with this, our fourth installment in our summer series, getting you ready for the 2020 calendar year to help you perform at your physical best as we discuss navigating common endurance injuries. Now, next up, let's explore some great tips around navigating and preventing bone stress injuries. Back on episode 281, Professor Stuart Warden shared a wonderful expert edition, Preventing Bone Stress Injuries in Runners. It's been very popular and it was laden with great and practical takeaways for runners and endurance athletes looking to prevent and best rehabilitate their bone stress injuries. And here you will hear Professor Warden share around why it is that not all runners have great skeletons and why we need to consider more than just training workloads when it comes to looking at the causation of bone stress injuries.
Yeah, we know that the risk of a bone stress injury, the biggest predictor of a bone stress injury is a previous history of a bone stress injury. You know, that's your number one risk factor. So if you've got an athlete who's had a stress fracture or bone stress injury in the past, then that raises the red flag already as to, okay, this person's already had a bone stress injury. There's a reason for it. And a lot of people will just put it down to, oh, they overtrained. Often that's not the case. You've got to look at every component, you know, from nutrition to sleep to caloric intake to, in females, menstrual cycle, all those sides, you know, the relative energy deficiency in sports side of things, the athlete triad. You've got to put it all together. But in terms of, you know, increasing someone's intensity, you've really got to go back. This is where you've got to go back and look at what they've been able to tolerate in the past and working out sort of what level did they get up to in the past before they got injured? Was the workload the issue, or was it some of these other extrinsic factors or intrinsic factors in the athlete that brought on that bone stress injury? You might just have to go a little bit slower on that athlete in terms of increasing the intensity. You might just have to pull back just a little bit and give them extra time in the lead up to, particularly to a competition or a particular race, so that they don't get to, you know, 1-2 weeks out and bang, they get hit with another bone stress injury.
And that brings up a great conversation point, Stu, around the assumptions so often that it's just they've overtrained. It's just a training workload error, yet it sort of ignores the biological ability of the bone to to resist load, which you write about in the paper, and I've heard you teach on this over the years. So that's bringing up things around the athlete's skeletal health. And one of the little subsections of this paper, which I thought was quite catchy, is this subheading or subsection, not all athletes have good skeletons. And the follow-on from that, the next subsection is distance running does not build good bones. So it's a big area, and I know you could speak for hours on this, but can you just touch on, Stu, some of the misconception about running and bone health and some of the underlying challenges that distance runners can have with their skeletal health?
It's true. Not all runners have good bones. We know a lot of bone health is genetic. There's also other components to bone health, whether it be history of mechanical loading, physical activity, and nutrition, vitamin D, calcium, and so on. But we know running is not a great bone building sport. We've shown this in animal models principally, that when you load a bone, when you load the skeleton, after about 100 loading cycles, so back-to-back loading cycles. So you think about someone running down the street, how long it takes them to land 100 times on their right leg. It's not very long. So after about 100 loading cycles, those bone cells become deaf, in a sense that they see that stimulus, they respond in that first 100 cycles, and then they start to shut off. And they're like, well, okay, we've seen that stimulus. Show us something new. And so if you think about someone going out for a long run, and after 100 or so cycles, loading cycles, those bone cells are like, yeah, okay, we've seen enough, and they start to shut down and they turn off. And so you can see why distance running, where it's pretty unidirectional, you're not changing direction, you're not loading different parts of the bone, you're just loading the same parts over and over and over again, that once those bone cells shut off, they don't respond to the other 20,000 cycles the rest of that day in that running cycle, or that running training that you've just gone on. The bone cells do become responsive again. So they shut off, but after about 4 to 6 hours, they become responsive again, and you can hit them again with another loading, and you can actually generate a better bone adaptation. And one of my colleagues here at Indiana University, Alex Roebling, showed this, that when you load a bone for 360 cycles, and you break those 360 cycles over 4 bouts throughout the day. So you do 90 in the morning, 90 at lunchtime, 90 at dinner, 90 at bed. You actually get more bone adaptation than if you introduced all those 360 cycles all at once. So they're getting exactly the same stimulus in terms of numbers of cycles, in terms of magnitude of load, and so on. The only difference is you're breaking it up into different bouts. So running itself is not a great bone building activity. This is why we often encourage runners to incorporate some other sort of activity in their daily life or their daily activities or exercise to try and think about bone building. The best time to build bone is before puberty. When we present on this, when we tell people, basically after puberty, it's really hard to build your bone. What we're trying to encourage people to do now is that if you've got junior athletes, young athletes who are really good runners, they're elite at junior level, is they need to be able to take time off from running. They need to do other sports. They need to load the skeleton in multiple directions to build a bigger, more robust skeleton. Because once you hit puberty and just past puberty, your bones don't get much bigger in response to exercise. You really only get it before puberty. So we try to encourage distance runners, cross-country runners to really not specialize until they get to high school. And high school in the US is, 9th grade in other countries. Really not to specialize. They can run and they can be elite, good runners before that, but they need to have time off and do other sports to load their skeletons in multiple directions to develop a more robust skeleton as they age.
And the benefit of that, Stu, is that a more robust skeleton post-puberty is going to help them in terms of dealing with micro damage accumulation and offsetting the risk of bone stress injuries, and more likely fulfilling their potential and enjoyment.
Exactly.
So if you are battling with a bone stress injury currently, or have had bone stress related concerns in the past, and you missed episode 281 with Professor Stuart Warden, jump back with your pen and paper. Support for today's show comes from Polar. The team at Polar want to wish everyone a very happy new year and a great start to your pursuit of your physical best. Polar have the experience, insight, and history of quality design and innovation which is unparalleled. If you're feeling like you need to get back and beat your best, then it may be time to upgrade your multi-sport GPS watch. Jump over to polar.com. You can check out the incredible features of Polar's multi-sport watches like Polar Flow, Training Load Pro, run and bike tests, so you can nail your VO2 max and power training alongside nightly recharge and recovery load pro features. All designed to help you absorb and make the most of your training and come back even stronger. Check out Polar's brand new GridX Pro, stunning military grade glass ultra long battery watch, and also the new Vantage V2 and Vantage V2 Shift, my own personal favourite, one of the lightest, most formidable multi-sport watches on the market. Jump over to polar.com and come back stronger in 2022 with a new GPS watch. And lastly, on this Summer Series episode, Navigating Endurance Sports Injuries, let's hear from episode 227's Expert Edition guest, British Columbia-based physiotherapist and researcher JF Esculier, sharing around guidelines for appropriate and safe running levels for runners with known knee osteoarthritis.
As we know, if you had knee pain for, let's say, 10 years and you're in your 30s, well, maybe it would be time to address it and not keep pushing through your pain. And what that means is technically your knees shouldn't hurt when you run, right? Especially if you're younger. And the advice I like to use is on that good old scale of 0 pain to 10 out of 10 pain, right? Well, 10 out of 10 is the worst pain imaginable. I like it when people don't go over that 2 out of 10 when they run. And if that pain, it has to be back to baseline or pre-running level within an hour after. And if the pain stays for longer than that, usually it's because you're overloading it. And because if the pain stays for longer, then you may create a little bit of swelling in your knee that's also related to that overload. And you don't want to reach that point because that could trigger maybe some changes longer term in your knee. Now, if you're an older runner, I like to use kind of the same thresholds, but I will also tell them, the following morning when you get up, you want to make sure that there's no more stiffness, because if you get older, you know exactly what I mean by stiff joints when you get up in the morning. You don't want any increase in that. So having, feeling a little bit of something during your knees can be fine when you run, as long as it's back to pre-running level within an hour after. I think that's the key point.
Yeah, that's so practical, JF. And then with the older athlete, the older runner, that extra caveat or scorecard, if you like, which is there any increase in stiffness the morning after?
Absolutely. And if you do have OA and you know about it, no increase in swelling the day after. So I think, those points are really key in knowing if you're doing it right or not. And because listening to your body, some people may say, no pain, no gain, which I totally hate in people with knee pain. I think it's the worst thing you could do to say, I'll just push through it. It's just not ideal.
So no pain, no gain doesn't hold tight here, but certainly those great tips you've shared are a guiding light. JF, in terms of the loads at the knee, as I've looked into this over the years of my professional life, it's quite surprising that we would perceive running as high loading at the knee joint. Yet, can you paint a picture around, how it actually relates, how it correlates or compares, if you like, to the forces that occur at the knee when we walk?
Mm-hmm. Yeah, and so you have two main joints in your knee, right? So you have the kneecap one, and you have the main joint that we call the tibiofemoral joints. And those two joints, let's say when you're walking, you would get about 1 to 2 times body weight at your kneecap, up to potentially 2 to 3 times body weight at your big knee joint, the tibiofemoral joint. And when you're running, it goes up to 5 times, between 4 and 6 times body weight at the kneecap, and it can go up to 10 times body weight at the tibiofemoral joint. So, is it high loads or not? If you put it that way, yeah, it is high loads, but, is it too much load for the body to adapt? Absolutely not. And there's, like you mentioned earlier, there's also the cumulative load. So how much total body weight you're applying over the course of one run. And some people think that this might be related to the development of knee OA. The answer is we don't really know, but for sure, if you go beyond your joint's capacity to adapt, then it may lead to some changes in your joint.
And it's quite likely at some point in your endurance sports years that you will experience knee-related pain. So hopefully that snippet was helpful for you. And if you need to jump back for JF Escoulier's full episode 227, do so with a pen and paper. There were plenty of learnings to be taken from that one. Well, there we have it. Another episode of the Physical Performance Show and the fourth and final installment in our summer series, prepping you up for 2022. May this be your best physical year of performance yet. As always, a massive thanks to the team that put this show together: Daryl Misson, audio engineering, Susan Wilkin, show administration, Matthew Walding, all things show graphic design. Now we have a wonderful array of learnings coming your way in 2022 with our weekly episodes and also planned upcoming live streams. And returning to the show in 2022 is one of our most loved experts, Dr. Stephen Seiler, forefather of polarized training. Now, I caught up with Dr. Seiler recently, who has some exciting updates for 2022 and a request to all endurance athletes, practitioners and coaches out there to help with some very important research.
Hi, this is Dr. Stephen Seiler. I'm looking forward to rejoining you for a 2022 expert edition and a live stream event titled Durability and High-Intensity Repeatability in Endurance Training. So stay tuned for the date release. But first, I need your help. My research team and I are looking for recreational to elite endurance athletes, females and males, young and old, to complete a punchy survey. It'll take about 10 minutes. We are researching the relationship between training characteristics and health experiences, both diagnosed health conditions and the little nagging things that don't get diagnosed. So please jump over to my Twitter account and click on the link from my pinned tweet to contribute your data to this research study. I thank you in advance for your participation, and I look forward to joining you later in 2022.
Big shout out also to our show supporters over on Patreon. If you'd like to support production of the show, you can do so from just $5 per month, and in return, we'll grant you complimentary access to all back catalogued and all upcoming live stream events. Just jump over to patreon.com. Now, coming up on next week's episode of the Physical Performance Show, we keep the learnings coming your way with a fun and informative look back at the top 5 running shoe innovations over the past 20 years. Now, some of the inclusions in this list may surprise you, and we'll hear and learn from repeat guests of the show, the Bartold clinical team, Paul Griffin and Simon Bartold. So until next week, keep pursuing your physical best performance. I'm Brad Beer, and this has been the Physical Performance Show.